And as the country continues to battle COVID-19, hospitals out west are struggling to cope with the increased number of hospitalizations. But despite the struggle, clinical coordinator for the Western Regional Health Authority, Dr. Delroy Frey, says the team has been pulling out all the stops. Here's Anthony Lugg with that report.
Buckling under pressure, public health facilities across the island as hospitalization of persons with a respiratory illness climbed over the last few weeks. Out west, clinical health officials have been painting a grim picture. Clinical coordinator for the Western Regional Health Authority, Dr. Delroy Frey, says the COVID bed capacity remains a concern.
All our hospitals are overwhelmed with COVID patients, so we want to minimize those admissions. Of course, once you have that high number, it's going to put a burden and a stress on the healthcare staff.
And if that was not already a task, nurses treating COVID patients have also been contracting the virus, creating a bigger problem.
I spoke with matron yesterday. We had 43 nurses who were off, and she has to be working very hard. In fact, every day the matron has to readjust. She has to, shuffle nurse around. People have to come back in from their leave. People who are newly employed, we have to cut like the orientation period a little shorter in order to fill that gap.
The latest data from the Health Ministry showed that the number of patients in hospital confirmed with the virus has decreased to 802. And with tighter COVID containment measures in place, it's hoped things will improve.
It's a big problem in order to deal with this pandemic. So it's a big strain on the system. But our job is to see how we can mitigate against it and to treat the patient as best as we can.
In the meantime, the management of the Cornwall Regional Hospital has been, among other things, expanding its waiting area for patients. Anthony Lugg, TVJ News.